For Wall Street Media, this is Melissa. I'm here with Doug, and we're going to help you make money in the stock market with information you can't find anywhere else.
Hey, good morning, kiddo.
Good morning.
Hey, guys, we've got highlights from you and a CEO video from the Maxim Growth Conference. Really good stuff, interesting stuff, and these guys are getting closer and closer and closer, right? They finally have, well, the first one that we have, I'm going to let the cat out of the bag here.
No,
so unlike me.
Job.
Is that these guys are working on non-small cell lung cancer, and they're really getting someplace. What do you have for us?
Well, you can find all the webcasts at wsw.com/webcast/Maxim. We have Brad Thompson, President and CEO of Oncolytics Biotech, ticker ONCY, who talks about the company's drug combinations and reporting schedules.
Go on to our last drug combination that I'll talk about, which is paclitaxel carboplatin. This honestly has the best signal out of all the studies that we have. It's really quite marked that this three-way drug combination has on patients that have failed previous therapies. We'll be reporting on the phase 1 and early phase 2 data on this again at the end of the month. We have 2 phase 2 studies now ongoing in head and neck, one in the UK, one in the States. And we have approval for first-line therapy, which is a little interesting, for non-small cell lung patients that are pre-screened for KRAS and or EGFR. So we're actually going to take EGFR patients and not give them the standard of care and put them on this particular program, which is, I think, kind of different. Just some scans again. This is a patient who had failed radiotherapy, had pelvic lesions and gross hepatic disease. Again, another liver. The big dark spot on the right is the descending colon, so that's not a tumor, that's fecal material. But the kind of darkish spots all the way through the tumor, or the liver at the top, are all tumor burden. About a third of this liver is metastatic lesions, and the enzymes are literally off the scale. After a couple cycles, which is only 5 weeks, the lesions are largely resolved. And after 6 cycles, which is 5 months, it's virtually completely resolved, and they went on to be resolved, and the enzymes are all back to normal. Second patient I'll talk about is, again, nasopharyngeal. In this case, they have lung metastasis for a little variety, and they had failed radiotherapy on the front line in the UK, which is cisplatin 5-FU. This case, on the right is the primaries. They're actually nodal disease, which is interesting again. You're getting complete resolution of the nodal disease and complete resolution of the lung metastasis again. So that was in the phase 1 component. And just as a teaser for later this month, this is an early scan out of, actually, I think the first or second of the phase 2 patients. This patient heavily pretreated radiation, cisplatin, Gemzar, carboplatin, carboplatin 5-FU, and docetaxel, so everything you want. So taxane and platinum resistant comes in on this, and after 10 weeks, you got a 97% reduction in metastatic load, and they're actually getting scanned this week for cycle 5, so I don't know the outcome on there, but some pretty early dramatic responses in a very drug-resistant patient.
Hey guys, on days like this when the market's super ugly, right? It's no fault of any individual company, and these guys are down today 5%, but everybody's down today. And what I'd like to talk about is biotechs. You can really hit the ball out of the park with them, and by that I mean you can make 4 times, 5 times, 10 times your money. But the way to invest in biotechs, and this is what everybody that I respect in the segment says, is you need to get a basket of them. Right, you don't put all your eggs into one company. This guy's a smart bastard, right? He had last week. I'm looking at their news feed, right? And he's a brilliant guy. And last week they got their 28th patent. This week they got their 29th patent, right?
On their way.
I mean, that's a smart guy, and you want to get on this train. But for any company, no matter which one it is in biotech, when they're early stage, now they've got stuff into phase 2, right? So we're not just sitting in like pie in the sky here. But you want to have a couple in there with the hopes that one of them become the biotech equivalent of Google, right? And you pick it up, and then if another couple in your basket hit it, you're in very good shape then. And that's the way you want to look at this. Now, you can watch the whole webcast, right? And listen to the whole presentation at
www.wsw.com/webcast/Maxim.
And that's what I'd recommend you do, is listen to the whole thing and use that as a starting point. And see if you think their approach is the right approach, and if they're one that you want to add to your basket. I was impressed with them. I was impressed with these guys.
But we also have Raymond DeHaan, CEO and President of MetPro Corporation, ticker MPR, who announced 3 consecutive years of rising sales and exceeded $100 million for the first time in the company's history. Randy Stewie, Chairman and CEO of Darling International, ticker DAR, announced the acquisition of grease collection company API Recycling. James Budge, CFO of Macrovision Solutions, ticker MVSN, announced capital expenditures to trend down significantly from already low levels.
And you know what? Hip insiders call that CapEx. I know you models, you guys must have slang too.
Yeah.
Yes, you do. I know you do. I'll tell someone on the show when she's not here. I'm gonna let the cat out of the bag.
Great.
As usual.
Start watching it every day.
That's right. What did he say? Our audience just increased by 1. Anyhow, guys, Maxim had a great conference. You should go to the URL that Melissa told you and watch the whole conference and start looking for ideas. Be selective in a super rough market like this. But they had different companies. They're all companies that they think have great growth potential, and you ought to take a look at them and then listen to the whole presentation, see what they say.
And you can find us here every day at Wall Street Media. Visit us on the website at WSMCO.com. Thank you.